So then I'm going to give my chapter summary. This chapter discusses different ways to manage the different dysarthrias, and some of the main things they discussed were the salient features and how to do different therapy with those features. The first treatment is speaker-oriented, which focuses on respiration or breathing required for speech production. If a person shows that they have adequate respiration, then no therapy is necessary for that. If breath support isn't adequate, then respiratory exercises can and should be done during different therapy sessions. The main thing you're trying to achieve during this type of therapy is to help the client increase help the client's phrases or sentences be able to be spoken without having to keep taking breaths to get them out. The second thing you look at is phonation, which is how loud or quiet the person talks. When working on phonation, the therapist is working towards getting the patient's vocal folds adducted. The chapter discusses resonance. If a patient has poor resonance, it can affect how often the person has to pause for inhalations, and reduce loudness and perceptual distinction of consonants. Therapy to work on resonance could require the client to modify their speech patterns, their use, the resistance training, and the therapist needs to give a lot of feedback and maybe even use a mirror to help the person identify what they are or aren't doing correctly. Then they talked about looking at the patient's articulation, which is kind of obvious. If the patient needs help in this area, then the therapist will do a variety of different therapy tasks to target whatever phoneme is missing or whatever they're doing wrong. And this might use behavioral management tasks, which are stretching, relaxation, traditional approaches, or referential tasks. And rate is another area that may need addressed. If a person's rate isn't being affected, again, you would do nothing with it. If it has been affected, the therapist can use rate modification. They might reduce pause time, increase interword intervals, use prosthetic management, or use non-prosthetic rate reduction strategies. This chapter also addresses prosody and naturalness, which is when naturalness is referring to how adequate the level of the prosody is. Some of the techniques used for this are contrastive stress tasks, referential tasks, and working with different breath groups. The final thing discussed was communication-oriented treatment. And this type of treatment gives the patient strategies to help with speaking and interaction strategies, which gives the patient opportunities to interact with other people, working on all the strategies, the things that they've been working on in individual therapy sessions. And that pretty much sums up the chapter.